Hello everyone, welcome to Healthy Living. My name is Lilian Ogedegbe and I'm here at the Modern Eye Care Clinic in Ojedu, Lagos, Nigeria. That's because today we are going to be paying attention to our eyes. If you take a look behind me, of course you will see glasses, eyeglasses. So that's because we will be looking at how best to take care of your eyes. And I have no other person but Dr. Priscilla Imade, one of our in-house doctors in Dove Television. And today I'm here live in your clinic. Hello Dr. Imade, how are you doing?
I'm good. Hello, Lilian. I'm very, very excited to have you in my domain live.
Not in the studios of Dove TV this time around.
Of course. You are welcome to Modern Eye Clinic.
Thank you so much. So all of the things you talk to us in the studio, how best to take care of your eyes, harmful eye practices that some of us indulge in, how to avoid them. Today we'll be doing practical.
Exactly.
All right.
I'm going to take you through all the instruments, all the eye tests, and of course, you are going to see how we do it live. Thank
you so much. So when I got inside, I saw Modern Eye Care Foundation. I was thinking this is Modern Eye Clinic. So what happened along the line?
Thank you. You know, as we are advancing, we are expanding our reach, we are expanding our scope. Modern Eye Clinic is still in existence. We just added a foundation to it. So we have Modern Eye Care Foundation. With this foundation, we are able to reach out to more people, both locally and internationally. And great. God has really been faithful.
Wonderful. Praise be to God. Thank you so much, ma'am, for having us in your clinic. And so at this moment, we'll be going straight to Dr. Priscilla Imade's inner office. Okay, so where we'll be having the conversation on how to take care of your eyes. So as we walk into her office, we're going on a short break for the exercise for today. Stay with us and you'll be learning so much on healthy living today. Can we go in, ma?
Okay, all right. Let's go.
Okay.
Welcome to today's episode of fitness segment on Healthy Living. I'm Messi Agbola. I'll be taking you through a series of exercises to your waist. Let's go. Hold your waist tight, and let's go first to the right, then left. 15 seconds counts. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. We go to the next side. Change. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax gradually. All right, we go by twisting your back, tilting into the back. Just 10 seconds count. 10, 9, 8, 7, 6, 5, 4, 3, 2. Beautiful. Relax gradually. Take it halfway forward. Beautiful. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. So we go for a motion movement now. To the sides. To the side. Can we have a 10 seconds count for this? 10, 10, 9, 9, 8, 8, 7, 7, 6, 6, 5, 5, 4, 4, 3, 3, 2, 2, 1, 1. Can we have the last by rotating the waist? Take it clockwise first. 5 seconds count. 4, 3, 2. We go anti-clockwise now. 5, 4, 3, 2, 1. Beautiful. How was it? It's really, really exciting here. This is another session on healthy living. I'm by name Mercy Hagbola. See you again.
Welcome back from that exercise break. You're still watching Healthy Living on Dove Television, and on this beautiful edition, we're reaching you from the Modern Eye Care Clinic here in Ojudu, Lagos, Nigeria, and I still have here on set Dr. Priscilla Imade. Let me quickly introduce Dr. Priscilla Imade to you. She is the National Secretary for Women Optometrists in Nigeria. She's also, at the moment, she's studying to be a fellow of the American Academy of Optometry. She's also the Vice President of Optometry Healthcare Providers Association of Nigeria, and she's a Doctor of Optometry with an MSc and PhD in Public Health. She is the MD and CEO of Modern Eye Care Clinic. So much that God has done for you. Welcome once again to Healthy Living.
Thank you very much, Lilian. I'm very, very excited to have you in my premise.
Yes.
And I know we're going to have a great time.
Awesome, awesome, absolutely, because we are so prepared. Because every time you come to Dove Television, Dove TV Studios, you talk so much with passion about how to take care of our eyes, and so much. And every time we hear your voice on radio, we hear your voice, see you on different platforms where you are advocating on better ways to take care of our eyes, telling us sometimes to love our eyes. I remember one time listening to you saying, "Love your eyes."
Yeah.
Thank you once again. It's such a beautiful thing to have you today.
Yes. Thank you.
As we look into our topic for today, just before I let you into our topic, we'd like to talk to God in short words of prayers. We'd like you to please lead us.
Let us pray. Father, we just thank you for this opportunity. Thank you for making it possible for Dove Television to come to my own premises today. We'll give you all the praise for everything we're going to discuss here. We ask that at the end of this program, your name and your name alone will be glorified.
Amen.
In Jesus' mighty name we have prayed.
Amen. Amen. Thank you once again, Ma, for joining us.
Thank you, thank you, thank you.
Thank you. Thank you everyone once again for joining us. You're watching Healthy Living, and today our topic is Eye Care the Right Way. Eye care the right way. So we know how best, what is the right way to take care of our eyes, and what is the wrong way, what are the wrong ways, to also think we are taking care of our eyes. Don't forget that you can always watch Healthy Living on Dove Television and also via our social media platforms. You can watch us on Facebook and also on YouTube using the handle at Dove Television. You can also follow us on Twitter and Instagram at Dove TV. And you can watch OH Prime. You can watch Dove Television on OH Prime. Please download OH Prime on your mobile phone. God bless you. Thank you so much. Thank you, Doctor, once again. So, Dr. Priscilla Imade, the topic today is eye care the right way. What is eye care the wrong way?
That's an interesting one. Well, first and foremost, eye care the right way was an inspiration given to me by God. And I sat down, looked at the way people practice the care of their eyes, the premium people place on their eyes and their sight. And after over 25 years of practicing optometry, I just got that inspiration one morning that I need to put this thing into a book. And I'm like, people are doing eye care the wrong way. They need to do it the right way. And I decided to write a book. So in the book, I wrote a lot about how people do eye care the wrong way. And then I wrote on how they can actually do it the correct way. Okay. So back to your question now, eye care the wrong way. Now, from my years of practice, I realized that people just feel they can do whatever they like to their eyes. They can, when they have eye problem, they can seek anybody they feel. And people are biased about eye care due to their cultural orientations, the aspects of where they live, their environmental factors, economic factors, and even religious factors. So all these things have made some people to treat their eyes in the wrong way, and at the end of the day, they end up causing more harm and damage to the eye. Sometimes I sit in my clinic and I have people come in, let's say somebody that have glaucoma, and then the person is coming in when the glaucoma is already advanced. And I'm wondering, where have you been? And the person tells me, oh, I asked my neighbor A, and she said if I could put XYZ in the eye, I would feel better. Oh, I sat back at home with the mind that the eye problem will go away on its own. Oh, I didn't just feel like wearing glasses. Because of that, I didn't want to come for an eye examination. And then they give all kinds of reasons. So this is a typical scenario that depicts how people do eye care the wrong way.
Okay.
Let me give you a simple list of the wrong things people do when it comes to eye examination.
Okay.
When somebody have an eye problem, I realize that the first person that comes to their mind, or the first thing that comes to their mind as per what to do, is not even to pray. It's not even the doctor. They just feel that, okay, let me observe and see, or let me ask my neighbor. I once had a case.
What is actually wrong with you? So that's why you be like, okay, let me see. Let me wait for the next 2 days. Let me wait for the next 3 days. If it persists, then I think I will need help.
That is a wrong way to take care of your eyes. You know why? Because most eye problems, on their own, they should be able to resolve within 24 hours or max 48. But if there is an infection, it becomes a problem. And also, the eye can self-heal. If within 24 hours you have a cut, say, on your cornea, and it doesn't heal, so why are you at home? What are you doing? So we are trying to change that narrative that if you have an eye problem, because the eye cannot see itself, because most time you will not know exactly what is happening within your eye, except you do an eye examination. Your first port of call should be the eye clinic. So that narrative is what we are trying to change by saying, don't do eye care the wrong way, do it the right way. So if you have Apollo, for example,
that's conjunctivitis.
Conjunctivitis. It will not be nice for you to sit back at home to say, oh, it will go away. Because you could call it Apollo or call it conjunctivitis. But by the time you come to the clinic, we can call it something else. Because it is not only conjunctivitis that makes the eye red. There are so many eye problems that can make the vision or your eye, that can reduce your vision or make your eyes red. I've had a case where someone has what we call acute iritis, and he felt, oh, this is iritis. You may not know until you come to the clinic. That's it. So, but the person, the eye was red, and he felt, oh, I have redness in one eye. This is Apollo. Let me just wait. I would apply water. I will apply XYZ. Okay, I will even buy eye drop from the chemist. And by the time the person came to the clinic, it was a very severe problem.
Wow.
I also had another case where a mother put potash in the eyes of her child because she felt the boy had conjunctivitis. I said, oh, I can treat this by myself at home. And then she ended up putting potash in water, putting in the eye of the boy, and the cornea got abraded.
Wow.
So self-medication is another way people do eye care the wrong way. It's not good to self-medicate when it comes to eye care, because the eyes are delicate. You never know what you will put in the eye that can injure the eye. That's a wrong way. And then asking your neighbors that, oh, neighbor, hey, what did you put in your eye when you had eye problem the last day? And then you say, oh, I bought an eye drop from chemist A or chemist B, and then tells you to go and buy it, and then you go and buy the eye drop and you start putting in your eye, forgetting that it may not have been the same problem. It could have been the same symptoms or similar symptoms, but the problems could be different. I give you another example.
So the education here is that even when your neighbor comes to you to say, oh, I know your child was down with this, what did you use? Simply tell that your neighbor, try and see a doctor.
Go for an eye examination.
I know I use this, but try and see your doctor, because you might just have something different from what I went through.
So self-medication, going to your neighbor to ask is, there are examples of the wrong way we do eye care here. And then putting different substances inside the eye, toxic substances. Why will you put something that is not recommended by your optometrist inside your eyes? So that is a wrong way to do eye care. And then we also come to the religious part of it. I've also had some people who say to me, I would rather pray than come for an eye examination. And I'm like, no, I believe in prayers. I know that God heals. But as you are praying, it is good for you to come to the eye clinic. Let's even put a diagnosis
to what you are praying about, so that when you are even presenting it in prayer, you know the exact name to call, and you know how to tell God to heal you, instead of just staying back at home and saying, oh, my eyes, I cannot see, I'm praying and everything will be fine. Yes, it's good to have faith, but we should know the place of medicine as far as, you know, eye care is also concerned. Another thing I also noticed that people doing eye care wrongly is, I find some parents actually refusing their wards or their children wearing glasses. Sometimes some children come to my clinic, they say, oh, doctor, I cannot see the board, or I cannot see very well, or, you know, they just mention certain astenopic complaints, and we're like, okay, let's do your eye examination. Discover that this child will need a pair of glasses to be able to see better. And by the time we tell the parents, the father will say, oh no, I don't want my child to wear glasses. Nobody wears glasses in my family. I don't wear glasses. Why should my child start wearing glasses? And on the basis of that, they will knock it off. Meanwhile, the child is being stressed. And a lot, you see, there are certain problems that if you don't correct them in childhood, and it grows with the child into adulthood, it becomes a more serious problem.
Dealing with situations as they arise, regardless of whether you have had that experience before, whether it's hereditary, whether your parents had that situation or not. The fact that you have this situation, deal with it.
Exactly. So that is it. So parents, please, I'm also using this medium to advocate that if you take your child for an eye examination and they need to wear glasses, please allow them wear glasses. There are some problems that even the glasses can correct in childhood, that as the child grows, it drops the glasses.
Okay.
While there are some, the child may have to wear the glasses throughout life. But whatever the case may be, the fact that there is a problem and there is a medical solution, I think that is fair enough. So please allow your children wear glasses. So that's also another wrong way I feel people do glasses, people do eye care, because they don't want their children to wear glasses, or even they themselves don't want to wear glasses. They just say no. Another thing I also realize, people doing eye care the wrong way is denial. Some people deny eye problems outrightly.
What do you mean?
Oh, I once had a patient who came in and we examined him. I would say, sir, we're suspecting glaucoma in your eyes. You have glaucoma, we need to do glaucoma workup examinations for you. You need to see the glaucoma specialist, and these are things we need to put. The blind person say, oh no, God forbid, nobody has glaucoma in my family. How can you say I have glaucoma? I don't have glaucoma, and things like that. So outright denial. And guess what? There was a particular case that was so painful to me. When this man came to my clinic, he was like in his early 40s. He came in and I'm like, sir, I'm suspecting glaucoma in this eye. You need to do SYZ tests and things like that. And he disappeared. He never came back. By the time he came, more than like 10 years later, wow, they led him into the clinic. Wow. He said he located at all. The glaucoma was now full-blown advanced. He said he located out of our area, and he was just buying reading glasses to be reading, and he felt okay with that. And he now suddenly realized that his vision was going dim. With glasses, he could no longer see. And he went to a general hospital where he was, and they now said he had glaucoma. That was when he remembered that, one Dr. Imade once told me some years ago that she was suspecting glaucoma, and that said, that he should bring him back to Dr. Imade. That was how he came back to the clinic and started telling me the story. Denial. It's not good to deny. Yes, some people too also deny on the basis of faith. It's good to have faith, but don't deny the problem, so you can channel your prayers appropriately.
Doctor, sometimes I think doctors should try and also understand with patients. I've just discovered that doctors make us feel like we are somehow sick or going or have one health challenge
or the other. Because
anytime you go to a doctor, whether it's an optometrist, whether it's a dentist, whether it's
they must see something.
Hey. You cannot go to see a doctor, say, I just want to have a general checkup, and after the checkup, after the examination, and they tell you, you're fantastically doing well, you're okay, you may go home. They will find something to say, this is wrong, this is wrong. So that's why you just prepare your mind. I know a doctor with glaucoma, I don't have it. Doctor, no, I don't have it.
What you have said now is a typical scenario I see every day. Now, Lilian, let let's look at it. Let's look at this dress you're wearing. If you wear this dress for like 40 years, how do you think the color will be?
Of course, it will fade away. It will be fading out gradually.
Exactly. You may still be able to wear the dress. The dress, the style will still be there,
yes.
But there could be some color fading.
Right.
Even if nothing else happens, you are sure there will be color fading. The same thing with your eyes and your body. From the day you are born and you are growing, as you get to age 40. In fact, right from birth, the generations can even start occurring, depending on if there are other secondary problems. But once you get to 40, for most people, you just discover that some form of degeneration would have happened. But it depends on what type of degeneration, where is it happening, are there things you can cope with, are there things that your visual system can accommodate, is it that your immunity, if sometimes the problems could be there, but because you have a high immunity, it can actually mask up or cover up, and then you may not need treatment. So when you come for an eye examination, for example, yes, we could detect some problems and tell you, oh, it's nothing to worry about, you can go. And there are actually people who still come and we are like, yes, we'll give you a clean bill of health. But for you to say, oh, if we go to a doctor, there must be something, so I'm not going, that also is a wrong way to practice eye care.
All right. So now we've seen some tips, some eye care the wrong way, that do not live in denial, do not delay. The moment you notice or you detect something could be wrong, something is actually wrong with your eyes or something, quickly see a doctor. And also do not ask your neighbors, okay, ask the right person, go to the right person to get the right answer to your question. And also accept and be proactive. What should I do now that, okay, I've been diagnosed of this, what should I do? All right, some of these things are better ways now to not to take care of the eyes the wrong way. Now, what is the right way to take care of the eyes, since we're looking at eye care the right way?
Yes, exactly. In fact, if you look at my book, if you go to chapter 16 of the book, I have a lot, chapter 15 actually of the book, I have a lot written out there, 15 and 16, telling us what we need to do. And then the first thing I would want to say is that when to start eye care.
When to start eye care. Okay.
So if you want to really take care of your eyes and you want to do eye care the right way, you need to start on time. Because the earlier an eye problem is detected, the better the prognosis. I give you an example again. Let's say glaucoma. Do you know glaucoma does not have symptoms? Because it doesn't have symptoms, someone that has glaucoma may not know that there is a problem.
Wow.
So, but when we detect it early, you come early to the clinic, we say, oh, we can better manage this, and blindness from glaucoma can be, averted or pushed away until, the person can actually, cope with all he needs to do in life. So, the earlier you come to the clinic, the better. So, we advocate that eye care or eye test should start from childhood. And that's why you see from birth. Eye care starts from birth. Just like you care for your body, you take your bath from the day you are born. The same thing. When a child is born, you see the pediatrician will go with pen light, checking for eye reflexes. That's part of the eye care we are saying. At 3 months, at 6 months, we are still checking for reflexes. 1 year, then at 3 years, an eye test can be done. It may not be full, comprehensive, but at least we want to know that the child is still able to appreciate something. At 5 years, when the child is about starting what we call primary school here, eye test should be done. We want to know, because it's with the eye that this child will learn in school. We want to know how well this child is seeing, because the volume of what the child will learn should be commensurate with what the eye can see. We learn by what we see, especially in childhood. So you do an eye test, and as the child moves from class to class, the eyes should be checked. Because you don't know when there is an eye problem at home, you cannot say you are your child's eye doctor. You need to bring that child to the eye clinic so that the eyes can be checked. So eye test starts from birth. And then where do you do an eye examination? We always advise everyone, please don't do eye test at home, because you cannot. Your eye is not like your hand. If you have a cut on your hand, you can see it, and you will know whether it's healing well or not. As far as the eye is concerned, you are limited to what you can see, except you're an eye doctor. Because the eye is like a ball. And the major part of it is embedded in the skull. You can see the skull. As we are looking at each other now, we're only looking at the anterior aspect of the eye. The major parts of the eye that will make you see is inside. And it's only when you come for an eye examination that the optometrist will be able to check, examine, and then advise you on what to do. So where to do your eye examination matters. So please go to an optometry clinic or an ophthalmology clinic, a certified eye clinic. What I've also realized in my years of practice that people, when they have eye problems, sometimes they go and meet religious leaders and say, oh, I have eye problem. And sometimes they go to their neighbors, they say, oh, I have eye problem. Sometimes they go to the wrong places and say, oh, I have eye problem. In as much as I don't want to dispute anybody's faith or what they believe in, the first place you should go for when you have an eye, you want to have your eye examined, is an eye clinic. I also realize that some people patronize quacks.
Okay.
They know they have eye problem. They know they need to see the doctor, but they want to boycott the process. You will see some people having their eyes checked by non-certified professionals, by quacks, and you are wondering, why with this person, the eye that's, without the eye you can't even appreciate anything? What if something now happens to the eye or gives you the wrong medication and the eye goes blind? So please, make sure you are examining your eye in the right place. So we have looked at when to start an eye examination, where to have an eye examination, who should have your eyes checked.
Okay.
No other person, as far as Nigeria, and even the world over, is certified to have your eyes checked except the optometrist or the ophthalmologist. Or in certain countries, ophthalmic surgeons, ophthalmic opticians, as the name designates. But you have optometrists and ophthalmologists certified here in Nigeria to have your eyes checked. Please, they are the people you should go. If you have an eye problem, just ask. Are you an optometrist or whatever? Let me even see your certificates. In fact, when you go to an eye clinic, most time in Nigeria, our certificates are on display. Our licenses are on display, so you know that you are in the right place.
You know, I just went to your page 13 of your book, the book titled "I Care the Right Way," and on page 13, I saw something written: "Lifestyle changes for good eye health." And I'm like, okay, so what are the things? What are the good exercises or lifestyle that can change my good eye health?
Quite a number of them.
Okay.
Quite a number of them. Number one, eating right.
Okay.
When you eat the right kind of food, you add them deliberately to your diet, it's going to improve your eye health. And then going away from toxins, people who smoke, for example, I know quite this program cuts across. It's not only redeemers that watch.
Course.
So people who smoke, they tend to have more eye problems than people who don't smoke. So those are wrong lifestyle practices that should be changed. Alcohol too can also mitigate, good eye care. So it's good for you to stop consumption of alcohol, stop smoking, eat right, and then avoid, putting your hand, because the hands are always dirty. Some people are in the habit of always putting their fingers in their eyes. When you do that, you may be infecting the eyes. And then some people too like to scratch. They scratch.
The eye is itching you. Your eye is itching you. I mean, you're meant to actually scratch it.
When you do that,
to get some relief.
Does it actually relieve? The more you scratch, the more you keep scratching. And then before you know it, the eye becomes red. The eye becomes irritated. You can start tearing. We don't encourage people to scratch the eye. If you feel itchy,
yes,
you can blink the eye, or you just take a napkin, put it in warm water and put over the eye. The itching will go down. And if it's persistent,
for someone who has makeup on, you don't expect, my eye is itching me, for instance, and I want to put towel in water to damp.
Just wink. Just wink.
Okay, wink it.
Because you may end up putting more infection. And with the makeup on and you are rubbing, you will rub the makeup inside the eye.
God have mercy.
So it's good to, as much as possible, if it's persistent, go and see an optometrist. There are eye drops we can give you that will help to reduce the itching. And then we'll look at what is actually causing that itching. We'll go to the root of the problem and solve it, so you could have some relief. So there's a lot we need to really do as far as doing eye care the right way. That scratching is one thing too that we should also stop. Scratching your eyes, doing eye care the wrong way. If you really want to take care of your eyes, please don't scratch. If your eye is always scratching you, go and visit an eye clinic. There are medications you'll be given.
Okay.
And also,
having said that, okay, these are the wrong way, the wrong practices that we do, and these are the right practices. And when the eye is itchy, wink rather than scratch and all of that. How do I maintain a healthy eye?
exactly.
I want to have a healthy eye. What are the how do I maintain it?
Good.
I know you have said earlier eating right. Okay.
Yes.
Tell me what other things.
Yes. First thing you should do is to make sure first understand your eye. How does your eye work?
Okay.
Understand the type of eye you have, and that you cannot know at home. So we start by having a comprehensive eye examination. If you want to maintain healthy eyesight, you want to have good eyesight, start with a comprehensive eye examination. Go to an eye clinic. The optometrist will check everything about your eyes, and then we tell you, oh Lilian, your eyes are these are your eye pressures, and this is how your fundus look like. This is you are short-sighted or long-sighted or metropic or presbyopic. So you understand the kind of eye that you have. Okay. If the eye is say myopic or short-sighted, for example, you will know that, okay, as a short-sighted person, there are certain things I should not do, these are things I should do. Or as somebody that is already experiencing presbyopia, okay, I should not strain my eye to read in the dark, because if I do that, it's going to make it worse. So you have an understanding. Or after doing the comprehensive eye examination, you know what your eye pressure is. Oh, you can know, oh, doctor said my eye pressure is borderline. Oh, I need to do apply certain medications, or I need to visit the eye clinic more regularly so that I can maintain this my eyesight. So once you are able to understand that, then you and your optometrist will be on the same page. Okay. So maintaining healthy eyesight, doing eye care the right way starts with a comprehensive eye examination. And then once you have done that, we'll now talk about timely eye examination. Timely in the sense that if you don't, take care of your eyes, if there's a problem and you don't treat it on time, if you delay, it can have a bad prognosis. Okay. Timely intervention gives a good prognosis. Having a comprehensive eye examination will help to detect the eye problem on time, and that one too will give us a very good prognosis. Then having regular eye examinations. I've had people who say, oh, doctor, I don't need to come to the eye clinic every year. In fact, there was a patient that came to my clinic yesterday. They said, oh, these my glasses, I've been using it for about 5-7 years. The last time I had an eye examination was 7 years ago. And I'm like, why? You ought to be coming regularly. Sometimes coming to the clinic regularly does not mean you are going to change your glasses. We just want to be sure that your eyes are still healthy, because from research we have seen that, especially when you are past the age of 40, that within a year your eyes can change. And if the eye changes and you are not doing anything about the change, what if the change is a negative change? Okay. So
speaking about comprehensive eye examination, how long does it take, just in case I walk into a clinic and I want to get my eyes examined? How long does that take?
Well, typically in my clinic, if you are doing an eye exam, it can take like maybe 1 to 2 hours. But if it's just a basic exam, that's about 30 minutes to 45 minutes. Now, there are differences between these examinations. When we are doing comprehensive eye examination, it means after we have checked your eyes, we are going to put what is called dilating drops in your eyes. We are going to open up the eye a bit and look at the back of the eye, look at the blood vessels.
Open my eyes a little bit.
We'll just enlarge your pupils a bit, not the eye are saying what we are saying now. Okay. We'll just put what is called dilating drops. Right. It will make us to look at the back of your eyes. It will make us see the back of your eyes better, to know whether there are changes or degenerations happening there. So when we do all that, it's going to take it's going to take some time. And then in doing comprehensive eye test, the first thing we do is to assess how well you can see what is far from you. So when you come to an eye clinic, for example, we put a chart of letters on the wall, or it can be on a screen. And then we say, okay, Lilian, let's read. What can you see? So the extent to which you can read those letters gives us an idea of how well you can see things that are far from you. We call that the Snelling visual acuity chart. It gives us an idea of how well you can see things that are far from you. For somebody who have good vision, should be able to see what we call 20/20 or 6/6.
Right.
Then we also,
all of these explanations, all of the things you're just saying right now might not really make that much of a sense to me until I see it happen. So
Yes.
since I'm in your clinic,
Yes.
I think we're going to go on a quick break right now
Yes.
so that I can get my eyes examined
Exactly.
and then can tell you the difference between now and just after the eye examination. Is that okay? Can we go through that?
that's okay.
Right, I'm
Yeah.
good. So we go on a quick break right now so we can even take the health tips for today. And just after the health tips, you'll be seeing me go have my eyes examined by Dr. Priscilla Imade. Thank you so much, ma'am, for having us. And I would like to go to your lab right now.
Yeah, we're going to the consulting room, actually.
Consulting room.
Yes.
Oh, okay. So let's go. Thank you.
Health tips for today. Exercise regularly. Start a balanced diet, emphasizing whole foods and avoiding processed and refined foods. Get plenty of sleep, at least 8 hours per day. Reduce stress levels by practicing mindfulness and relaxation techniques like yoga or meditation. Have regular checkups.
At this moment, I'm about to examine Lilian's eyes. And Lilian, you're welcome to Modern Eye Clinic.
Thank you so much for having me here.
Well, in carrying out eye examinations, the first thing we do is actually to check your blood pressure.
Oh, okay.
We want to know whether you came in with good pressures. Because if your blood pressure is not okay, it's actually going to affect, it could affect our results. So I'll just check your blood pressure first, and then we'll go on with the eye examination. Okay, would you want to?
That's okay. I can do.
Yes. Okay, so just turn your hand. Okay, you can relax your back. You can relax your hand as well. So Lilian, let's see if your blood pressure is okay.
Right.
Okay, your blood pressures are good.
Okay.
All right, so the next thing we are going to check is to assess how well you can see what is far from you. So we have a chart there. That's the visual acuity chart. Okay. You are going to read for me what you can see, and the extent to which you can see will determine how well you see what is far. We'll start with your right eye, so you cover your left eye this way. Okay, so let's read now. Can you see those letters?
Yes, I can. I can see a large capital letter A.
Okay, just call it out as alphabet.
On the, A, O, E, H, L, A, N, T, C, O.
Okay, I'm going to show you some smaller ones now. Can you see those ones?
H, L, A, O, T, N, T, O, L, A, E.
Good.
L, N, E, T, H, C, A.
Good.
Oh, I'm not certain of that. Okay. O, T, L, H, E, N, A. Not certain if that's O or C.
Okay, the last line.
L, H, T, O, C, H, E, A.
That's good. That's good. You really did well. Let's move it over now to your left eye.
Okay.
Lilian, you read well. That's good.
Okay, thank you.
Yes.
H, L, O. Sorry, I take that again. H, L, A, O, T.
Yes.
N, T, O, L, A, E.
Yes.
L, N, E, T, H, C, A. Not certain of that.
Yeah.
O, T, L, H, E, N, A, O. L, H, T, O, C, H, E, A.
You tried. That's very good. That's very, very good. Okay. Because I'm going to be coming very close to you, I need to wear my nose mask. It's part of our procedure to wear nose mask whenever we're coming close to a patient, not necessarily because it's COVID. Okay. Even before COVID, we always wore our nose mask. Okay. So let's see what you can read here now as well. I want to see. Well, these fonts are quite tiny. Let's see. I'm still going to cover one of my eyes. I'll just cover it for you. Oh no, I can't attempt the first paragraph. I'm not sure I can attempt that. Okay, but let's try. Okay. Now we have. And still I'm not certain. What about this eye now? Can I try the second line? Okay, try. How satisfying is the eye and to the mind? You try, that's great. Okay. Okay, so we're going to look deep into your eyes now. This test is called the ophthalmoscope, and we may have to, okay, we can leave the lights. Okay. Because of the camera. Oh, you were going to turn off the lights earlier. Yes, oh, okay. I see. Don't worry, just relax. Let's see. Just want to have a look at your eyes. Can you look up now? Okay, look down. Okay, look towards me. Okay, let's see. Look up. And look down. Okay, just look straight. So I'm going to look right in your eye. Okay, this test, I just did now, it's called the ophthalmoscopy. Opta what? Ophthalmoscopy. Ophthalmoscopy. Okay. Yes, you see. I'm actually seeing your eyes. Wow. Okay. Am I supposed to be blinking my eyes while you do that? I'm supposed to leave my eyes straight. You can. Oh, I can blink. Just look straight here. Okay. Let's see. Checking your reflexes. Okay. Oh my God. So I'm getting my eyes examined here at the Modern Eye Clinic. Okay. Yes. So I'm actually going to check. I want to use this now. I want to check what's your refraction. What is my refraction? What does that mean? Yes, this autoref will help us to check how well the refractive status of your eyes. That's if you will need glasses. Okay. What type of glasses you will need. And of course, it's going to tell us what's the power of lens too that you will need. Okay. If someone is just testing or examining his or her eyes for the very first time, is there a particular test to do? And if I've been having my eyes regularly checked, is there a particular also test to do? Yes, there are some basic tests that we must start from. Okay. There are some that we can skip. There are some that we must necessarily do depending on the diagnosis. Okay. For example, if you are someone that have not had your eye checked maybe in 2 years or a year, we may have to check your eye pressure. But if you've checked your eye pressure, or even though your auto refraction, your glasses are still okay, we may not do it within 3-6 months. Okay. If you are coming for a follow-up, it could be a follow-up for some other problems. Okay. So you're going to put your chin here now. Okay. Put your chin. And then let your forehead touch that place. Touch it, yes, just sit in. Okay. Here's eyes now. Can you catch this image? So this is how Lilian's eye look when we do an auto refraction in the eye. We can see her pupil here. So if you just tell us what her refractive status is. It's blurring at the moment. Yes, when it's about to snap, it's going to go blurry. Okay, we can see her eye. Can you catch this image? Good. So, okay, we're on the other eye now. So, okay, you can sit back now. Wow. Okay, I'm sure you're going to see them by the time they come out. So, the next thing we're going to do now is to just have a quick refraction for you
So we may have to remove this now.
Okay.
Okay, just for the purpose of this now, let's just put it here. So this, we are doing a refraction for Lilian now. We just want to refract her eyes to see what lens power she's going to use to read. So we just look straight. Can you still see the
yes,
picture?
I can see the alphabets.
So okay. So can you read them?
Yes, I can.
Okay.
So we have
Okay, go ahead.
HLAOT, NTOLAE, LNETHOA, OTLN, ENAO, LHTOC, HEA.
Very good. Okay, so once we are done with this now, we just try to frame you.
So what's this called?
This is an interrupter.
Okay.
Once we use it for refraction.
Okay.
It helps us to know the exact power of lens that you are going to use in your eyes. Okay. So that's what we have framed you here on now. Yes, sorry. Okay, good. Okay. So you can see read.
All right, we have HLAOT, NTOLAE, LNETHOA, OTLHENAC, LHTOCHEA.
Very good. So let's see these letters you were struggling to read the other time. Let's see if you can still read them.
Oh, now they seem bolder in my eyes.
Let's see. Let's look at this now.
All right, so now we have reached the tree, the beautiful trees, never so beautiful as today.
Good.
Imagine the effects of a straight and regular double avenue arc nearly a mile ago, achieving overhead and closing into perspective like the roof.
Let's see if it's clearer now or before.
Now we have reached the tree.
Which one make you say better? One.
Oh, I think this is better.
Oh,
this is so clear.
Now.
This is so clear.
Compare it with your eyes.
Comparing this with my natural eyes, oh my God, Lilian. Speaking faith, you are blessed, but reality, I can't see.
So that's the end of the test. So you have a bit of a hyperopia, and then.
You know, when you see an optometrist, of course they will give you that term that you ask them again. What does that mean? I have what?
A bit of hyperopia,
okay, what does that mean?
Early presbyopia. But then it's nothing for you to worry about. Okay. At least your vision is okay. The way you can see things that are far from you is still very okay. You only just need, some more eye power in your lens to be able to read what is near. And when someone is over 35, getting to 40, start having that challenge for the eye to be able to accommodate things both at distance and near, especially when the prints are printed.
Okay. All right. So
you are going to wear this now, and then we are going to walk out together.
Oh, fine.
I want to see how well
I can.
You can see with the lens.
Okay.
If we are giving you this as your glasses, we want to be sure that you'll be able to walk around, you are comfortable with it. So you're going to stand up now.
Okay.
And we're going to walk around. We just want to try frame her to see if you see well with the glasses. Please just look around. I hope you can still see people.
Of course, I can see people.
Mr. Sanaye, is that you?
Yes, I can see people here in the clinic, and I can also see you at home watching Healthy Living today on Dove Television. Let me quickly remove it so you can see that it's Lilian talking. I've just got my eyes tested and examined today, and I want to say thank you everyone for being a part of this program today, Healthy Living, and our topic today has been eye care the right way. So please ensure that you get your eyes tested today. Get it tested today. My name is Lilian Ogedegbe. I must thank Dr. Priscilla Imade for having my eyes examined and for inviting us to Modern Eye Clinic where I got my eyes examined today. Healthy Living will be back next week and time on the same station. Once again, thank you so much, ma'am.
Thank you for coming to Modern Eye Clinic.
We'll be back next time.
Mommy is greeting you.
Oh.
This mommy Agbe. She's...
Thank you. Yeah. Thank you so much. We'll see you again next time. Bye now.